Cerebrovascular Accident. Stroke by Myrtle Pettit. Cerebrovascular accident is a type of vascular disorder. There are many precipitating factors to CVA, such as hypertension, hyperlipidemia, diabetes mellitus, heart disease, atherosclerosis, arteriosclerosis, thrombosis, and severe dehydration. Moreover, there are also predisposing factors such as lifestyle, vices like smoking, drinking, age, diet, sex, heredity, and even self-medication. Both the precipitating factors and the predisposing factors contribute to vasoconstriction. Added to that is embolism. All leads to the blockage of the blood vessel and thus result to the lack of oxygen and nutrient supply in the brain. The lack of oxygen leads to hypoxia, which may lead to cerebral ischemia. Hypoxia leads to altered cerebral metabolism, which might lead to cell death and decreased oxygen level. Altered cerebral metabolism leads to decreased cerebral perfusion, which may lead to intracerebral hemorrhage. Decreased cerebral perfusion, however, may lead to local acidosis, to cytotoxic edema, to aneurysm rupture. From this, varied stroke issues may occur, such as ischemic stroke, which has predisposing and precipitating factors like high blood pressure, smoking, heart disease, diabetes, arteriosclerosis, poor oxygen supply to the brain, high cholesterol, and unhealthy lifestyle. Next, subarachnoid hemorrhage, which has predisposing and precipitating factors like high blood pressure, smoking, and family history of aneurysm. Venous stroke, which has predisposing factors like severe dehydration, severe sinus infection, genetic predisposition to formation of blood clots. Large artery stroke, which has predisposing and precipitating factors like hypertension, diabetes, smoking, and high blood cholesterol levels. Transient ischemic attack, TIA, or mini stroke, which is related also to ischemic stroke. Small artery stroke, which has predisposing and precipitating factors like hypertension, diabetes, and smoking. And last but not the least, embolic stroke, which has predisposing factors like atrial fibrillation or irregular heartbeat, myocardial infarction or heart attack, heart failure, and patent foramen ovale or small hole in the heart. With a stroke listed above, this can lead to brain tissue necrosis, which may bring paralysis to the patient or can lead to death. The most common etiologies, according to VanMeter and Hubert, are large artery thrombosis. This is a blockage in one of the larger arteries in the brain, such as carotid or middle cerebral artery. Next, small penetrating artery thrombosis. This is a blockage found in smaller, deep penetrating artery. Third, cardiogenic embolism, an embolus or blood clot that traveled from the heart to the blood vessel. Here's a list of risk factors for stroke. being overweight or having obesity, lack of exercise or movement, sleep apnea, heavy drinking, smoking, drug use, diabetes, cardiovascular disease, high cholesterol, high blood pressure. These are the risk factors for stroke. So how can we prevent stroke? According to nurselabs.com, keep your blood pressure low. Eat healthy food. Exercise regularly. Treat sleep apnea. Manage your diabetes. And I replace it with avoid drinking. Stop smoking. Avoid stress and maintain a healthy weight. What are the main symptoms and signs for cerebrovascular accident, or CVA? Nurse Labs made an infographic showing the mnemonic B FAST. B for balance, loss of balance, headache or dizziness. E for eyes, blurred vision. F for face. One side of the face is drooping. A for arms. Arms, legs, weakness. S for speech. Speech difficulty. And T for time. Time to call ambulance immediately. What is the most common treatment protocol to treat the disease? Common medical treatments for stroke is the use of clot-busting agents or thrombolytics like tissue plasminogen activator or TPA to reduce some CVA effects. This is, however, contraindicated to anticoagulant drugs in patients with hemorrhage. Glucocorticoids are also used as part of the treatment to reduce cerebral edema. Physical therapy and speech-language therapy are used to help the patient recover sooner and perform basic function of the activities of daily living. What are the long-term implications for the patient? Patients suffer from speech and language difficulty. They have difficulty conveying their thoughts, comprehending things, and may even be naming things. They have to relearn things or find ways to effectively communicate. They also suffer from swallowing problems. The control of swallowing is impaired, so they have difficulty eating and drinking. They have poor visuo-perceptual skills. This means that they often focus on one side of their perceptual field and often lose the ability to pay attention on the other side of their perceptual field, which is often the left side. Thus, they are prone to bumping on the walls, tripping, and falling onto the floor. They are also at high risk in developing emotional problems, such as depression, anxiety, and mood changes. They suffer from an empty mood, feelings of guilt, worthlessness, hopelessness, fatigue, difficulty focusing, experiencing insomnia or hypersomnia, also known as oversleeping. They may also suffer from appetite changes and even entertain thoughts of committing suicide. They also may develop personality changes. After stroke, the patient may lose interest in favorite activities, do things inappropriately, and may exhibit inappropriate behaviors. Thank you so much for your time. A shout out to our professor and my colleagues in the doctoral class, HSCI 840. Hope you enjoyed my short animation. Yours truly, Myrtle.